Hello everyone, my name is Zachary, and today I will be doing a joint presentation with Sarah Trela-Hoskins, a fellow UROP recipient for this study. And our project is titled Sleep, Diet, and Physical Activity in the COVID-19 Pandemic. But before we begin, I'd like to recognize our PI/mentor, Dr. Kelly Barron, who's the head of the study, and the Division of Public Health, Department of Family and Preventative Medicine. Now, before we dive into our current study, I'd like to shed some light on a previous study that's done by Bloom et al. Now, as far as the COVID-19 lockdown goes, we are experiencing major shifts in our patterns of life, which may have wide-ranging consequences for health. And shown in the slides are data extracted from a demographic of 327 participants, aged 25 through 34. Now, I'm not going to go over this in extreme detail, but what the researchers found will be that sleep duration and sleep quality has significantly changed before the lockdown and during the lockdown. And our study is going to be a qualitative study on why this may be happening. Now, sleep is a fundamental health behavior, but what are some outside factors that could potentially impact our sleep quality? Well, due to COVID-19, there are a lot of many different factors, such as stress and coping with this COVID-19 pandemic. There's also illness severity and even adherence to prevention behaviors. Our lab will focus on two aims that investigate the nature of how COVID-19 is dominating daily routines. First, we will evaluate the effect on stress and the ability to participate in healthy behaviors over the next 6 months. And second, we will understand whether obtaining a habit of maintaining healthy behaviors are successful for reducing psychological distress and improving prevention behaviors such as washing your hands, wearing a face mask, and social distancing.
Hello, this is Sarah Trela-Hoskins. Next, we want to go over our study design. Throughout the course of our study, we are seeking 200 participants all over the age of 18 who are currently residing in the state of Utah. Our participants are encouraged to complete 3 time points of study participation. The first week of study participation will be at time point 0 months, which will involve one 15-minute interview, a follow-up survey after the interview, morning and evening surveys for 7 days, and 2 dietary recalls on randomly selected dates of that week. The second week of participation is nearly identical but without an interview or dietary recall. This week's participation is scheduled for 1 month after the first week of participation. The third and last week of study participation at time point 3 will begin 3 months after the initial interview and will follow the same guidelines as the first week. The purpose of the 7-day morning and evening surveys both serve a purpose. The morning survey to assess sleep the night prior, and the evening to assess stress, symptoms, and prevention behaviors of that day. Today, we have screened a total of 256 individuals and enrolled 128. Our inclusion criteria is as follows. They must own a smartphone, they must live in Utah, and they can't be pregnant or planning to become pregnant. 39% of excluded participants are pregnant or planning to become, 27% are not living in Utah, 11% do not have a smartphone, and 22% are not interested. As of now, our median age is 38 years old, and almost 53% of our participants are female. Recruitment methods we are using are Craigslist, Research Match, word of mouth, and Reddit. Additionally, we have been in contact with Community Faces of Utah to increase outreach to underrepresented populations in the state of Utah. Here we have a list of the questions we ask each participant during their interview. Please take a moment to look over. Alright, next we have composed a list of common trends we have noticed in our interviews. As you can see, many people have been sleeping more. Some people's physical activity has significantly increased while others has their exercise has significantly decreased. As for dietary habits, we have noticed a lot of people mentioning increased snacking. A lot of people are cooking from home as well. Some people claim to be eating healthier, not grabbing that quick fast food dinner on their way home from work. And we've also noticed that a lot of people are talking about how their jobs have transitioned, whether they are working from home now, some people are working different hours, others are furloughed, and unfortunately some people have lost their job. And then as going along with that, a lot of people, especially our older, middle-aged population, they have kids that are now no longer going to school. They are working from home as well, which has brought another stressor for some parents. And then social life, a lot of people have been switching over to communicating with loved ones over FaceTime and over the phone rather than seeing them in person, where others are still seeing them in person but wearing face masks or practicing social distancing. A lot of individuals have had increased anxiety throughout the last couple months due to the pandemic, but also other people have mentioned that the earthquakes and Black Lives Matter movement have also spiked their anxiety as well. And we've also noticed that not very many of our participants have had COVID-19 or someone close to them. Yeah. So here are some statistics regarding COVID-19 that our study really highlights. When we ask participants to complete the virtual surveys for our study, we ask a few very important questions. Have you been tested for COVID-19? Has a family member been tested? Do you consider yourself a high-risk individual? If anyone answers yes to the first two questions, they are then prompted to answer another question. What was the result? These questions can help us gather an understanding for how many of our participants are directly fighting COVID-19 in their home. A question we could further look into: how do individuals who have COVID-19 or had COVID-19 in the past respond to our questions, our interview questions regarding the pandemic versus those who haven't had anyone close to them or themselves be diagnosed with COVID-19? Can we find a trend? The fourth statistic that you see on this page is elevated insomnia scores. This is calculated using the Insomnia Severity Index, where people have clinical insomnia according to the total number of insomnia-like symptoms they have going on. Whether these people are going to bed significantly later, waking up earlier, or simply having restless sleep. The last statistic on this page that I thought would be important mentioning in this presentation is elevated anxiety scores. We used the Generalized Anxiety Disorder 7 scale to assess our participants, and what we noticed over our entire population was that 30% of people felt an increase in anxiety in the last couple months, which is an interesting point to think about. On this slide, I wanted to highlight the preliminary insomnia index scores that we gathered. I decided to break up some statistics into our total insomnia score versus the average insomnia score versus only men, only women, and anyone over the age of 50 years old. What we can tell by this page is that men tended to have an increased insomnia at the beginning of the pandemic than women did. And we also can see here that people over the age of 50 tended to have increased insomnia scores compared to anyone under the age of 50.
Now, going into our data analysis portion, we'll be able to evaluate fluctuations in symptoms, behaviors, and stress. So the primary way that we analyze our data is through a technique called coding, and we are currently using this program called Deduce to code. Now, before I get into coding, I'd like to mention that our project is a qualitative research study. Now, Sarah mentioned earlier that we conduct qualitative interviews, right? So we then have to transcribe those interviews and input them into this program so that we can code. Now, what is coding exactly? Well, coding is a process of labeling and organizing qualitative data to identify common themes and relationships between them. And just a reminder that qualitative data and qualitative data analyses is a process of examining and interpreting non-numerical and unstructured data. Now, why is coding so important in qualitative research? Well, it's so important so that we can assign certain themes to the transcript, which makes it easier for us to summarize the results of the entire survey. And yes, I can show you guys a better idea as we move on to the following slides. Now, on the last slide, I mentioned a little bit about transcription and how we have to transcribe our interviews so that we can put them into Deduce, right? So since our project is currently ongoing and is incomplete, we only have about 9 to 10 transcripts into our program. But out of those 9 to 10 transcripts, we have common themes that we've noticed. And these are the themes here. We have prevention, we have family, media, physical activity, diet, sleep, stress, and work. And in the next slide, I will explain these themes in a little more detail for you. What you're seeing here is a sample of the qualitative data that we have so far. I'm going to go ahead and explain what each of these codes mean and how many times it reoccurred during the transcriptions that we made. The dark blue cells on the left-hand side represents the codes that we made through the transcripts. The number that you see in that same row represents the number of times that the participants have shared with us. And the cell directly left of that would be an example of what the participant would share with us that relates to that code. Let's take a look at the first code on the left-hand side, the prevention code. Here we asked the participants about what types of precautions they are currently taking. Out of the responses that we recorded, we noticed that common themes would include face coverings, social distancing, hand washing, and disinfecting surfaces and objects. The next code, which is directly below the prevention code, is the family code. And here we asked the participant how their family is impacted during the COVID-19 pandemic. Some common themes here would include their child education, their work-life balance, their parenting abilities, and their ability to reconnect with family and friends. Next, we have the media code, where we asked the participants where they're currently seeking information about COVID-19. We have varying responses that range from social media, online information, and television. Next, we have the physical activity code, and here we asked them how their physical activity was impacted during the COVID-19 pandemic. Now, moving to the right-hand side of the slide, we have another table with codes. Let's start off with the diet code, and here we ask our participants how their diet has changed during the COVID-19 pandemic. Their responses include having healthier eating habits, unhealthier eating, increased snacking, and even excessive alcohol intake. Next is the sleep code, and here we ask how their sleep quality was impacted due to the pandemic. Some responses would include having very vivid dreams and nightmares, either having increased or decreased sleep times, and insomnia symptoms. Next, we have the stress code, where we ask how their stress levels have changed throughout the COVID-19 pandemic. Some stress examples that the participants would mention would be COVID stress, the uncertainty, financial stress, family stress, and even other stressors such as earthquakes and the protests that we've been seeing on the news lately. And lastly, we have the work code, and we asked the participants how their work was impacted during the pandemic. Here, we have been getting responses that relate to school or college, job loss, and working remotely. Again, this is a summary of the data that we have so far, as this is an ongoing study, and we suspect that we will have a better idea and outlook of our data as we progress through the study and having more coding done.
What what can we do next? Well, since our study is still in progress, we are going to continue doing some data collection. We are also working on transcribing each of these interviews and coding it using Deduce software. We will continue recruitment, and in this way we will be working more with community faces of Utah to broaden recruitment. We are also going to be completing interviews in Spanish going forward. And then we also are going to be targeting a population between the ages of 46 to 79 due to little data collected from this population currently. So going forward, I have a couple questions I want to answer. The first two questions are in regards to dietary changes. And the third question, how has COVID-19 impacted physical activity? These three questions are really interesting to me because I am currently studying kinesiology at the University of Utah, and I'm interested in how our choices and our lifestyles that we create for ourselves really impact our body and our mind overall throughout the duration of our life. The last question, what types of precautions are people taking and how are they changing over the span of 3 months, is really curious to me because I am interested in why people are changing their precautions. Do they feel safer? Are they more afraid? Are there trends in different age groups that are worth noting? Anyways, if you have any additional questions for myself in regards to my study, please feel free to email me. I am sure my email will be provided on the UROP Symposium.
Now, when discussing about stress, COVID-19, and sleep, I have several questions that I'd like to ask and hopefully to learn more about as this project continues. My first question would be, how has physiological stressors impacted sleep performance during the COVID-19 pandemic? And these physiological stressors can include anxiety, depression, or even just general stress. My next question would be, do certain stressors have a stronger effect on sleep quality than others? And my last question would be, what are the most efficient coping mechanisms for stress during the COVID-19 pandemic? I hope that you find our research project very informative and interesting. But if you have any more questions about COVID-19, sleep, or stress, I highly encourage you to read this amazing research article that actually our PI, Dr. Barron, was a part of. This article will help you learn about how to better manage your sleep during a pandemic.
All right, so that is it for our presentation today. Thank you for taking the time to review our project with us. We've spent a lot of time and effort trying to put this all together. Thank you, Zachary, for working with me along this project. And then I want to give some thank yous to Layla Lincoln, our supervisor, who plays a big role in making sure everything is done efficiently and correctly. And then thank you to Celine Tobin, who's our graduate student working with us and making a huge difference in the amount of recruitments we've been getting done every week. And thank you to a couple of the other undergrads who are volunteering and also doing work study, Alex Bennett, Kiana Orr, and Henry Thomas. They have been putting in numerous hours every week to make this study happen. And lastly, I want to give a big thank you to our consultant, Sarah Cabajal Salisbury, who is really making a huge difference in our sleep study, our COVID-19 Spanish project. Without her, we wouldn't be able to include people who only speak Spanish in our study. So thank you, Sarah. Please let me or Zach know if you have any questions or concerns about our project. Any input that you can provide us would be greatly appreciated. And that's it. Thank you. Bye-bye.